As the demand for medical oxygen increases with the surge in COVID-19 cases, citizens are being encouraged to follow the non-pharmaceutical measures to prevent the further spread of the virus. The non-pharmaceutical measures include avoiding crowds, physical distancing by 1.5 to 2 meters, wearing of masks in public places such as markets and shops, following hygiene measures such as washing of hands with soap often or using sanitizers, and coughing into bent elbow rather than into the hands. National Control Center clinical lead Dr. Scotty Candelio said oxygen is the main medical therapy for COVID-19 patients. Dr. Candelio said a single moderate COVID-19 patient consumes oxygen in two 7,600-liter cylinders in 24 hours, and a critical patient consumes oxygen in three 7,600-liter cylinders in 24 hours. He said the oxygen consumption has increased by more than 100% in the said provinces. Oxygen supplier BOC Gas has reported that it has increased its oxygen supply by 75%, but the logistics of supplying oxygen to the hospitals is very challenging. Therefore, health facilities have to be proactive in assessing their oxygen capacity and to request for resupply before the buffer supply is depleted. Recently, more than 400 oxygen concentrators have been distributed to each province, about 18 per province on average. In order to ease the demand in the regions, the National Pandemic Task Force has built an absorption oxygen plant in NCD. The Deputy Controller for the National Pandemic Response, Dr. Daoni Esorom, cautioned that oxygen is also required for other medical sections and conditions. The strain on oxygen supply will affect these areas too. Dr. Daoni said CEOs of provincial health authorities must order their oxygen requirements accurately to prevent out of stock. Frida Kana, TV1 News.